They're falling apart again.
I know. This is Jim's house. I see the second.
That's right. Okay, it's 10 o'clock. Morning, everyone. Call meeting order for guys and pledge, please.
Pledge allegiance to the flag, of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Terry, you can try to open this up if you'd like.
I'd like to have a moment of silence for the safety of the Artemis 2 crew. If anybody didn't see that yesterday, that was exciting to see history in the making. Thank you.
Thank you, Terry. Roll call, Vicky.
Commissioner Van Alstad,
Here.
Commissioner Scola,
Here.
Commissioner Hellwig, Commissioner Rubin,
Here.
Commissioner Heck.
Here. Thank you. Any public comment this morning? John? What's going on? Yeah.
Hello, and doing good. I finally had a thought to why this so-called building has to be put over here, and I think it has to do with water and sewer. We have at the last board meeting, I learned that the county has property across from Meadowbrook and next adjacent to the shelter, which would make a very good place to put building for incarceration, recessed from the highway, like the animal shelter. And then take this building over here as so-called, it has a health department, put them in front of the Antrim County Transportation. There's plenty of parking lot space there. And they also would have easy access to the clinic from there and give this building over here to the sheriff for administration. The fields here in town right now have been already overflowing, and with our new workplace place community over there adding to it, and also I heard that there's mold and mildew over there, and that's something probably the building department's addressing, but that had to do with what's underneath all those buildings. That would be something that would they should add another. I've heard they should add another pond over there because the overflow is going into the wetlands and getting into the river system, and that is not good. And having the building outside of town would probably make a lot more people happier. And giving that space to the sheriff, I think, would be appropriate. Taking this building over here across that they call the jail compound now could be redone on the inside. I've done interior demolition in buildings. I've used a jackhammer in there, so it can be redone. You have brick there. You got this wonderful failing siding on this building out here. You can see that it's faded and it's going through oxidation right now. And I don't know how long it's been in here, but that would be something that I think could be accomplished instead of putting this big building here in town. And also, we probably should get a water tower for this town, like Shanty and like Turtle Creek, so that there is water pressure that goes along 88 during the summer when the family fair tries to cool down their building. They run water on the roof, which affects the whole water pressure along that corridor. So that's something that needs to probably be addressed. But I really would consider, the county isn't supposed to be owning land, by the way, too, according to certain regulations, as far as what counties can and can't do with property, because they're not getting taxes or revenue from it. And having my train of thought, where am I going with that? But having a water tower up on the hill would increase a lot of pressure for the people that are using the system down below for their businesses. And I know that from talking to people that have businesses there, that it goes down when they start watering the roof. That's Family Fair. And you do have the property there. You can utilize it. I'll be back.
Thank you, John. Anyone else? Morning, Terry.
Morning, my name's Terry Mullen. Got some issues that are new. We were talking about sewer last time we were here. How about the owners that have sewer fields on other people's property that's not being protected by their agreements and rights? They go to circuit court, they win, but they don't win because their property is still being damaged by the owner. You can go to court and get a show cause and go back again, go back again, go back again. I've been fighting this for 10 years. I just got out of court and I won, got a breach of contract. 2 days after I got the judgment, the owner was already on my sewer field. So I think the county needs to make some kind of rules or some kind of regulation so the prosecutor can do something about it. The other thing I have is animal problems. We don't have a nuisance law where Antrim County Animal Controller can do anything about multi actions. Each owner should have a limited time of having a dog loose or violations in our county, and after the strike 3 rules in other states and counties, I think that's what we need to look into. I've been having dog problems just as long as I've had sewer problems. And nothing's being done. I've got video cameras of dogs being in my yard, ripping it up and urinating. All Heather can do is write a right citation. We need to have a nuisance law. Central Lake's got one, but they don't want to enforce it. So that's where I'm at with that one. The other one was the maintenance problem I have. I still think we need to look into that because we have unskilled maintenance people doing work that they don't have any idea how to do. And that is an issue that I've seen for 2 years. And I also asked for memberships to have meetings with me, and I haven't had any calls. I asked for a finished meeting with Jeremiah over there, or Jeremy Scott, and I had one on that. And then on the prosecutor, we need to do something about this picking and choosing because that's not helping our citizens if he can pick the crimes that he wants to do, and then the ones that don't get picked are still repeating. So if a crime's being repeated in this county, the prosecutor should be able or made to do the case. Because nothing's being done by the circuit court winning, and the prosecutor doesn't do anything about the crimes. These are my complaints today. I have more, so I'll be back.
Okay, thank you, Terry. Anyone else? Okay, moving on then. Can I get a motion to approve the agenda, please?
I'll make that motion.
I'll support it. Thank you. All those in favor, please say aye.
Yeah.
Opposed. Minutes from March 19th, any corrections? Can I get a motion?
I'll make a motion to approve as presented.
Support. Thank you. All those in favor, please say aye.
Aye.
Anyone opposed? Reports, committee reports, liaison reports, anyone?
I got this
Sure.
one. Village council last night, the village of Bel Air. Bill Drollinger's retiring, and they appointed or hired a new chief of police. And he will be starting the training now. He was the police officer, so now he'll become the chief, and they're gonna look out for a new officer. So Mr. Fisher should do a fine job there.
Right, thank you. Cheers.
The Antrim Conservation District at their last meeting, voted to, terminate their director effective immediately. And, so Mike Merriweather is running it for now, and, he's indicated that he's gonna be talking to that board. Yeah, he's not sure that they need another full-time employee. He thinks the 2 they've got is probably adequate for what they're doing. More discussion for that. They'll be here probably next month to give the annual report for the Conservation District. And also had some discussion about the recycling sites, and there seems to be a problem in various ones with bags, loose bags blowing around and making a mess. So talking about if fences would be appropriate and where. Sounds like they're gonna try the Ellsworth station first. See if they can put up a fence there this summer. So keep trash from blowing into neighbors' yards and to the ditches and stuff like that, so. Oh, the Antrim Creek Natural Area also met and our parks director was successful in getting a grant for them. Redoing the schoolhouse, it's $40,000, so. There'll be more info to come on that.
Right. Anything right? Annual reports. Renee is with us this morning. Morning.
Good morning. Hope everybody had a nice slide in. Well, first of all, the first thing I need to say is thank you. We continue to be very robust and very busy at the Antrim County Collaborative. And we have a few things to share with you. I'm not going to read the whole report to you. We'll just get to the good stuff, the accomplishments. So I do want to talk first about.
Sorry, Renee, Jeremy, can you bring up Renee's report that we received electronically so the rest of the folks can see it?
Thanks.
It arrived after our package, Jeremy, but I think I received it yesterday, the day before. Sorry, Renee.
That's no problem. I'm sorry that it was late. I had a corrupted file and I had to do that awful thing, call my son and ask for help. It took a couple of days to do that. It's hard to be that humble.
I know I can fix it.
I kept trying, really, Jerry, I did.
Or whatever it's worth, Jeremy, I'll ask the same thing for the fair board when we get to that point. So thank you.
Amen.
Thank you, Jeremy. Go ahead, Renee.
Thank you,
Yeah.
thanks. Well, the first thing I'll start with is the jail simulation. Now, Terry asked me about this just a little earlier. I want you to know that though we did that simulation now several months ago, it's still informing our information going forward, specifically our decision-making going forward, recognizing, I should give a little background on that jail simulation. Essentially, what happened is we sort of went through the life of a day of incarceration and what it looks like if you've been released on parole or probation and what, all the things that you need to do after. I'll cut right to the chase to the end of it to say that what all of us walked away with, and Kevin was there as well. We just walked away thinking, gosh, we've got folks that have so much to do once they're released. We could be doing that while they're incarcerated. We could be doing that and making sure that they're ready for release and to reduce that recidivism of them going back. So that is informing much of what we're doing going forward. I do want to talk a little bit about the proposals that we had last year, the RFPs last year for the opioid settlement funds. And we were set aside, allocated, I know $100,000. We did not spend that, as I shared with you last year. Part of the reason we didn't is, frankly, the proposals we received weren't that robust. There's no reason just to spend money because you have it. You know, we wanted it to make a difference. So the two that were selected, one was from Addiction Treatment Services and theirs was for a rural outreach program. I will say the good news in that one is it was so successful. They had so many people using it and so much success that they are continuing the program. And they're doing it without the opioid settlement funds. And they were able to do that because the data that they collected from doing that program allowed them to find the funding to make that happen. So yay, Antrim County, that's great news. The other one was through the senior outreach program, and I know they worked with Paula and MORC. The intent there was a prevention, recognizing that often the availability of opioids at our grandparents' homes or my home, and our kids come in, they just shop the medicine chest. Let's be honest, and they can do it. And so we wanted to have some education in that regard. Also education regarding how to prevent an overdose. So they were giving kids to prevent the overdoses, which is great news. It got a little bit of a slow start because we really wanted to make sure we targeted the residents of Antrim County, and recognizing that many of them head south for the winter, had to adjust the schedule a little bit for the snowbirds, but did that. We did take a look at a program called RX Kids. RX Kids is a program that will provide an allocation to pregnant mothers. And through that first year, the last 3 months of their pregnancy, and then going into their after they give birth, the intent there is to set them up for safe and stable families, the cribs and the things that they might need to make their home stable. Finding childcare, some of you know this, that even if you find childcare, you often need to get that childcare before your child is even born. And you have to secure and pay for that before they're even in there to keep the spot. Childcare is that tough. So the program wasn't right for us this year. I'm sorry to say, we had to come up with $160,000. It had to be ready right now to access the $900,000 program. We simply didn't have the funds to make that happen. We thought we would be able to use Central Lakes program as an existing match. So actually use existing monies, we could not, it had to be cash match. So I am working with the Grand Traverse Regional Community Foundation to see if there are any benevolent donors in Antrim County that might be interested in making that happen. It's a long shot, but that's what we do, long shots. We're also working on a felony and misdemeanor expungement clinic. We just took a look at this at our last meeting of the collaborative, and said that, you know, we know that there are a number of people who, those were past misdemeanors and felonies. They're getting in the way of them getting jobs. They're getting in the way of them getting housing. It changes everything. If after 10 years, you'd like to have that expunged, there's a possibility and a way to make that happen. We're looking at doing a clinic for that. It's about $10,000 to do that clinic, but we might be able to bring some other counties in, reduce that cost a little bit. And the last thing here on the things that we're working on is a regional mental health campus. This has been in the works for actually several years. The campus will be located likely in Kalkaska because they have a lot more state land that might be available for that. But the intent there is a place that provides residential placement. That's very difficult. Our jails are not residential placements. They often end up being residential placements for mental health services. That's not ideal. We'd like to see that happen. There is an opportunity, the current administration, Trump administration, has set aside through the Department of Health and Human Services, $100 million for each state to address rural health concerns. The rural health concern in Michigan, in the entire state actually, is access to mental health services, and specifically access to residential services. So we're following up on that. And finally, good news, we're rural. That doesn't usually happen. You know, we actually have funding set aside for us for rural services. The last piece I want to talk about a bit more is the opioid settlement. So we are moving, and I know it feels like we're moving at glacial speed on that opioid settlement stuff. But I will say that there have been, through the course of this last year, since I was last here, we've had some big changes that happened, good changes. One of those is that we now have technical support to help us in expenditures of those program dollars. That's really important. And the reason I say that to you is that previously, there were counties spending those funds and actually received a bill to say, you've got to give that money back because you spent it wrong. We don't want that to happen to Antrim County. We can't afford to have that happen, right? So we're moving with caution, and we're very deliberate in making sure that we are absolutely compliant, but impactful. for the folks in Antrim County. So the other thing that happened, of course, is the passage of the Public Safety Center. So we've looked at that and said, you know, this is an opportunity for us with the Public Safety Center, with the courts heading in the direction that they're heading, and with the opioid settlement funds. We believe that those three things coming together give us an opportunity to provide a case manager that may be able to work outside or with the Public Safety Center and actually work with every person who comes through there to do that intake, as we were talking about with the jail simulation, actually do an intake with somebody. How is your housing situation? What is your transportation situation? What's going on with your kids? You know, as somebody who used to do parenting classes at our jail here, it wasn't set up for me to do parenting classes. It wasn't set up for me to do that. I'm just gonna say, and now we'll have a place that is actually friendlier for us to do that, right? So we're excited about what that might mean. I have a meeting in 2 weeks with Amy at the state, and I think we'll have a good draft to put together. I'm hoping by May 1st, to share with you and see if we can bring that forward and see if we have some folks some agencies who want to do that program for us. That's going to be the next big step, is that effort. I don't know what agencies what agencies might want to take this on, but it's exciting. It's an opportunity for Antrim County to be a leader. As I often share with Jeremy, I said, I love an opportunity in Antrim to be first for something besides being the letter A. We get to be first in this, so I'm excited about that. So I don't know if you have any questions. I can go through that. Any questions from anyone?
Sure, yeah.
Sure.
The Regional Mental Health Campus, I'm on the board for North Country Community Mental Health.
Mhm.
And I just wondered if you've had any conversations with them, and I know that Kalkaska County is also in our CMH.
There.
So that's maybe one of the reasons why you're looking at putting it there, but just wondering what kinds of conversations you've had with them and what that's.
We've had several conversations with them. Jody Scholl from North Country is on our collaborative membership, so she's at the table most of the time. And we've had these conversations before. The big question really, Commissioner, is who's going to lead this? Because community mental health already has so much going on. So who's going to be the lead? And we're hopeful that it's actually, I'm gonna say it, we're hopeful it's a state-run facility. Because that's really the best opportunity. If it becomes an agency-run facility, then I think that the concern is, especially for community mental health or all of our mental health providers, is we don't need competition. We need, I call it co-opetition. You know, it's okay for us to cooperate and compete, right? But the issue really is finding social workers, caseworkers. Community mental health struggles with that. If we put in a facility like this, it's really going to tax who we are as far as what we have for that staffing. So that's a big challenge. What I can share with you is that we've had conversations with U of M and already talked to them, and they're very excited about an opportunity to place interns here, which would be helpful. And I think in the end, actually bring that staffing stock that we may need to Northern Michigan. So there are ways to do this that we can all win. It's not, it doesn't happen overnight. It does take some time, a little finessing and some networking, maybe coffee once in a while with somebody. We get it done.
You have a rough estimate of the cost of, I mean, how many beds or rooms?
I'm told that we are just about 60 some beds that we would need to service northern Michigan, northern lower Michigan. We don't have anything up here. There's simply nothing here. We struggle not only with the adult population, but youth populations as well. So we need to take a look at both. We've even had some conversation about whether there might be a place for some substance use disorder addiction services at a site like that as well. But again, ideally, what we're looking at is a campus. Everyone that's been working on this says we don't want this to be a hospital kind of place. We want this to be a place that is healing, a healing environment. So again, we've been working on it. What's going to happen next, candidly, is whoever is the lead on this, we have to hand it over to them. All of our ideas would just go to them, and they're gonna have to make it work with whatever funding they have, whatever regulations they have. But again, the good news is for this $100 million that we're looking at for the state of Michigan, and we might get about a third of it to put this campus together. You know, I'm excited that it's rural and that it specifically indicates mental health services, substance use disorders, and the access for technology for rural communities to access health services. That fits what we need to a T. It's our name's written all over it. You just need to make sure that they did that too.
And then circling back to what you talked about first about folks in jail and getting out of jail.
Mhm.
It's been emphasized to me recently that some of these folks, when they're either in jail or they're these folks with addictions and things, when they're either in jail or in the hospital in an emergency room, at the end of that is sometimes the first time that they've been sober in a long time. And so getting them some counseling and some accountability and a reason to stay sober.
Right.
Trying to tell someone to be sober when they're not sober, they're not thinking all on all cylinders. So they've emphasized that the last couple of months, and you're just talking about your jail simulation. I know we hired a gentleman that had been incarcerated for a while, and so many things change while they're in jail. And they get out and they don't have a driver's license. And people are using cell phones. They weren't using cell phones when they went in jail 8-10 years. I mean, this has been a few years, but these types of things, there's things changing that those of us who are just adapting to life and going on from week to week, we never think about. And I keep bothering the sheriff from time to time about work release and looking at inmates that would be eligible for that and what it would take to do. And I know I've probably mentioned it to you before too, but that's just one thing that they don't have to, oh, I gotta get a driver's license and I gotta look for a job and I gotta find somewhere to live. Well, if they've got the job part down, that's huge because they have income
Mhm.
to get their driver's license and they have income to put down on a place to rent, and they don't have to look for a job, and they know their fellow employees and their boss wants them to succeed because they're contributing to their community in that way. So.
Well, again, I'm very pleased to say that that's where we're looking, is somebody that's dedicated to do that. I know that the sheriff's office has, well, that's really not what they're there to do, is that kind of case management, and they're being forced to do that. To your point, when somebody's in there, they're looking at withdrawals. That's, addiction withdrawal. There isn't anybody there that can help them with addiction withdrawal. That's not what they do, and yet they are, because they have to. So, we're really committed to making sure that that happens now. And I do need to close because I'm already taking up too much time. I do want to say that as we venture into this, the opioid settlement funds are very, very targeted. There are only certain populations we can use it with, but that doesn't stop Antrim County from finding other funds to build that program so it can do more than just that. Because again, there's mental health issues. Often those are together, mental health and substance use disorders, because they self-medicate, so we can put those things together. We can build that kind of program. This is an amazing opportunity to have a decade plus, nearly 2 decades worth of funding to be able to address this. We have a responsibility, and indeed, I think I used the word in here a couple of times, a legacy, an opportunity to create a legacy program here that will actually make a difference in Antrim County. And we are working with state models. We're working with Traverse City, who has a similar model, but we want it to be our own. We don't have the same resources. You know, we just simply don't. What I believe we do have is something that we can create from this because we have the will of the people in Antrim County to make it happen, and an opportunity to do it. So, if we've got those two things together, we're good to go. We're good to go. Oh, and I did forget to mention that I have worked with, and I'm gonna have to take a look at Concerned Citizens Group, with the one that, okay. With Gary Knapp. And Gary and I have a long history together, and he actually used to do this job before I did. But there isn't any reason for us to run on parallel tracks. We don't have that many resources for people to do two things in two different rooms. So we will come together and make something happen. We have very similar interests. The one thing I did share with Gary is we have to make sure that whatever we do is research-based, that there are evidence-based programs that we can use. That's really important for sustained funding as well. Actually, if we use the wraparound program, and I think, Bill, I may have even used that with you, but anyway, if we use the wraparound program, for example, that's actually a program that could be Medicaid reimbursable. Imagine doing a program at the sheriff's office where we could actually be reimbursed for those funds. And the irony isn't lost on me that often when somebody goes in there, they're taken off of Medicaid. Our job would be to help bring them back in, get them back on those services so that we can get them access to mental health services and substance use disorder services. So it seems a bit like it runs around in circles, and it does, but that's okay. Because, we want to circle around this thing. That's how we're gonna get it. We're gonna get it. Any other questions?
I just, can you clarify real quick, the opioid settlement funds, because addiction and mental health almost are intertwined, but you made a point that that mental health is, as far as opioid settlement funds, that it can only go for addiction, correct? Did you say that?
No, we can do there's some prevention work we can do, but it really needs to address opioids at this point, and I did touch on that a little bit here. There will be another drug. There always is. I wish there weren't, but there always is. And at some point they will have to change this. In the course of this last year, since it was last year, we've already made 2 changes. The most recent was the 9th of this month or March. So that's part of what we're staying ahead of. And that's part of what this dedicated person is going to have to do, stay ahead of this thing. Cause it's always moving. We're trying to board this train as it's moving. We can, but.
And do you think like with the public safety center, because substance abuse and mental health it's very important if we can trade, the people that are coming into the system, help them to be productive members of society, for them, right? You know what I'm saying? Do you think with the funds that we have, that we could have like a dedicated person on staff? Is that possible?
I do. And in fact, that's what we're talking about here in this RFP that we'll do next, is actually having a dedicated person. Really, they'll be looking at the opioid settlement piece of this, but again, we want whoever that person is to make sure that they are considering how we might be able to expand that. The mental health campus that we're talking about there, that if we can make that happen, that's a no-brainer. That's a partnership that the public safety center has to have. and that connection with the courts. Again, what an amazing, we have an amazing opportunity here. Unlike so many other counties who, right now, it's just sort of all coming together so nicely. So I say celebrate your vision and let's get this done.
Thank you.
Thanks.
Good.
I just want to say, Renee, I appreciate your leadership, not just on this matter, but throughout the years. And we are, I am really counting on the collaborative to address everything you've mentioned here today. It is important to the community. There's a great number of people in this community who the treatment aspect of this whole public safety center is front and center for them. And I know that we've got the right people on that. And so thanks for your assistance and your advice.
I appreciate all of you. Thanks so much.
Thanks. I'll make a motion to approve the Antrim County Community Collaborative's 2025 annual report.
I'll support it.
Thank you. Supported. All those in favor, please say aye.
Aye.
Anyone opposed? Thank you. Moving on now to the Fair Board. Good morning,
Morning.
Carolyn Grimes.
Yes, I'm Carolyn Grimes. I am the current president of the Antrim County Fair Board. After last year's many position changes, it fell to me. So we sent in our annual report this year, just showing that the fair actually came out on the positive last year. We actually ended up with a little bit over $6,000 of profit after a $9,000 loss in 2024. So we're pretty thrilled with that. We're still tightening our funds, but and we've shrunk our fare down a little bit this year. We're going to be on the same weekend as Rubber Ducky. So we're sharing with them, and we'll only be open to the public Wednesday through Saturday instead of a full, Thursday through Saturday instead of Wednesday through Saturday. So, we had, a lot of community support again this year. We were very open with all the cutbacks we had to make. But we had our pie contest, which had 3 participants. In 2024, last year, we had more than 20 bakers who came out. So we found we were a little underprepared because we had 1 judge. But we weren't expecting a 700% participation increase. So yeah, so we had we're doing the fair without MSU for the first time last year. We had hit a couple bumps, but we were able to overcome those. We had a very successful market livestock auction. Had a total of 33 bidders come out. About half of those were actual buyers in the end. But we had over 70 animals, almost 30 different exhibitors in just the animal barns. I didn't count every entrant in the still exhibit, but we had a full still exhibit barn as well with crafters from the local community and stuff. So it was a very positive year. So I don't know if you guys have any questions. I don't know what else to say.
With the advent of not having the MSU extension running
Yes.
the fair, do you guys have any plans to get more kids involved with the raising animals and bringing them to the market?
We are doing as much outreach as we can, trying to get word out to the community, trying to get people to understand that that looks really scary because we maintained a lot of the requirements that 4-H has. My kids are still in 4-H and exhibiting at our fair. So we still allow 4-H, they just don't participate in any of the running of the fair anymore. But we have brought in several people from the community who didn't want to be part of 4-H, but are excited about being able to be part of the fair themselves. I think we had a total of a dozen of those exhibitors were 4-H exhibitors last year, so everybody else was open exhibitors from our county. And the ability to be able to market without being 2/3 of our market were non 4-H. So that was really good. We did see an increase there. And I know we have a few extra that are coming in this year, who also are not 4-H. So we're trying to reach out to the community. MSU with their change in leadership is also partnering with us a little more, trying to help just the agriculture join back together in the community, so.
Good deal. Thank you.
Sure.
Yeah, just. I attended most of the fair board meetings last year and, I just want the public to know and the board that, Carolyn, she will go above and beyond if there's kids that want to have an animal at the fair. If they didn't quite meet, they didn't realize the deadline was last week, she'll set up a special meeting for them this week. Anything to allow the kids to be able to display their animals and to market them.
Yeah.
She goes above and beyond. So if you have kids that are like, oh man, the deadline was, Carolyn will work with you and get your paperwork done and get your requirements done. She goes above and beyond.
Yeah, we've really been trying, we have our signups online and we had several people that the online system occasionally just fails us. And it was confusing for some people, and so we would call and follow up and help them get their entries in and stuff like that, even in our still exhibit barn and stuff like that, so.
Any other questions?
Good to go.
Great fair.
Thank you very much. I appreciate it. I made a motion to accept the Antrim County Fair Board's annual report.
I'll make that motion.
Support, thank you. Supported, all over there, please say aye.
Yeah.
Anyone opposed? Claims and accounts. I get a motion to approve claims and accounts in the amount of $52,317.96.
I'll make that motion.
I'll second that. Questions on the bills? Sure.
Yeah. Number 40. Fleet mechanical for 1382.
Yeah, it's not named for a company. We failed our our sprinkler system. There was backflow issues, and so they were the company that came in.
And then number 43, is that for 911?
Yes, that's mapping for 9.
Jeremy, 41, can you explain that a little bit?
Great Lakes Veterinary Forensic.
Oh,
Yeah, that's.
yeah, well, it's an open case, so I can't explain.
Okay. Okay.
Frederick?
Yep, okay.
Frederick? Move second, all those in favor, please say aye.
Aye.
Anyone opposed? Sheriff's Office, this is a 2% private grant acceptance. I'm looking for a motion to accept $15,003 from the Grand Traverse Band of Ottawa Chippewa Indians tribal allocation to 2% funds for assistance towards township approved block LBR camera leases.
I'll make that motion.
I'll support.
Thank you, moved and supported. We have, we have the sheriff, the undersheriff, and Detective Martin here today, so. Any questions for the sheriff's department? Hi, George. Good morning. Morning. Go ahead, Jeff.
Yeah, George. I'm a little concerned, looking through this, question number 15 of the grant. It says, if new staff is required, will preference be given to Native American applicants? And the sheriff's department clicked yes. I guess.
There would be no new staff required for that.
I kind of figured that that was the case, but if someone moves or we hire a new staff, then does that apply, or how does this?
Excuse me 1 second, it was.
Page 9.
I mean, I'm just thinking. If we got a 911 call and we have a deputy that comes out to a case, I mean, we have someone who's got a firearm, they've got a taser, they've got a body camera. I want them to be the best person they are. I don't care if you're black, brown, or white. I really don't care. I just want you to be the absolute best. So it's just where I'm going with this.
Well, absolutely, no, I would agree 100%. If my page 9 doesn't line up with that, I got 205.
It's question number 15 on the grant.
If new staff is required, okay, well, I mean, yeah, yes, we'll check on that, but I mean, this program wouldn't require any new staff. So, I don't think that's like referring to like, we have to hire any new deputies, that they have to be Native American. Which, that answer your question?
Kind of.
Yeah.
I mean, people retire. You get what I'm saying? People retire, people move, whatever.
Sure.
So we need 2 new deputies. Then does this apply or does it not apply? They're not the new staff, they're replacing existing staff, so it doesn't apply.
Can I interject there? There's no staff. This is specifically just for leases on cameras. There's no staff involved. We couldn't be expended. If we had everybody leave and came in, this money doesn't go towards funding that staffing. It's only towards the camera lease per what was filled out. So it can only be for objects. There's no NA though, unfortunately.
I was gonna say that it sounds like this question is not applicable in this situation.
Right.
Okay, that answers my question.
Yeah, thanks.
Good, James?
Oh, and then I guess just, the background is for, flock cameras for townships.
Yes, sir.
Are we gonna inform all the townships? I mean, how did? If,
What we've done so far in this preliminary part, we've mapped out strategically the best places where we need them. And we contacted those townships that fall within those strategic areas. So no, not all the townships have not been contacted.
well, I mean, that makes sense to me. I mean, you want the camera where there's the most need for it, not just because somebody in township X wants one.
Correct.
Yeah, and I know I have a township that has or is getting 2 of them. And I don't know if 2 of them is necessary in one township, but I'm sure your office is gonna work with townships and communicate to them why or why not.
Yes, absolutely.
Right.
And George, does the township board or town, they have to give permission, they have to basically allow this, right?
Correct.
The sheriff's department can't just go in and put the device.
For the ones in this one, yeah, we have to get their permission because they're on their roads.
Thank you.
Yes, we do.
And George, very similar to Ray's question, again, this is really an initiative between the Antrim County Sheriff's Department and the potentially 15 townships in Antrim County, correct?
Yes, sir.
And so again, you are gonna require the permission of the townships if these are installed anywhere.
Yes, sir.
Any other questions? It was moved and seconded, all those in favor, please say aye.
Yes.
Aye. Anyone opposed? Thank you, George.
Thank you.
Thanks, George.
You got the votes.
Moving on, Commission on Aging, Paula is here with us as well. I'm looking for a motion to authorize the COA Director to execute the Senior Project Fresh Michigan Department of Health Memorandum of Understanding and Data Disclosure Agreement.
I'll make that motion.
Thank you. I'll support. Thank you. Moved and supported. Any questions for Paul? Yes, Paul.
Yeah, I'm just wondering, is this a recurring I had a thing, or is this new, or can you just give me a little background on it?
Yeah, the Commission on Aging has participated with the state of Lansing for many years. But the program changed last year where they went to like a charge card kind of a system out of the state of Lansing. Before that, we used to get coupons that we distribute to people who qualified. Last year, they really limited the ability of all Commission on Agings or, county representatives to assist seniors. Basically, they ran it through the state. So last year, we didn't have an agreement because we did not have a role. But previously to that, we had agreements every year. Basically, what it is $25 card that seniors, if they're in a certain income level, can apply for. Last year, they kind of tied our hands to be able to help them, which was really cumbersome for the senior. They listened to a lot of feedback from all over the state of Michigan, revamped the program a bit. They're still controlling it in Lansing, but now they're giving us access to go online and look and see, did the senior's application get submitted? Were they given the card? How much money did they have left on the card? But because now we have access to their system, we need to make sure that we have confidentiality and HIPAA guards and all of that in place, which is what this agreement is about. So we ended up with a pretty complex agreement in order to help people, but legal reviewed it and they think we're okay and there's nothing to address. So we've been doing it. It's just that the program changed, which is why this is new to you.
My concern is I have seniors that they don't like going on the computer, or they're not able to go on the computer, and they're kind of cash based, so having a card is just gonna confuse them and make it more difficult for them. That's.
And everyone around the state is giving that feedback to Lansing, but they did not change that part of it. The part that they changed was now we can help people actually do that. But you're right, and a lot of feedback on that.
Good. It's moved and seconded, all those in favor, please say aye.
Yeah.
Anyone opposed? We'll go into our follow. Moving on, Pace North Provider Agreement, looking for a motion to authorize the COA Director to execute the provider agreement between Pace North and the Mission on Aging.
I'll make that motion.
Thank you. Also, thank you, moving supported. Any questions for Paula in regards to this? Cheers.
Can you just go over the units briefly and how that works?
So we charge in 15-minute increments. And so if we had a personal homemaker go into a home to do bathing or whatever, and they had an hour assigned, we get paid for the hour, but for 4 units.
Any questions on that? Moving second, all in favor, please say aye. Anyone opposed? Thank you, Paul.
Thank you.
Have a good afternoon. Moving on, notice of privacy practices policy. Looking for a motion to approve a new notice of privacy practices. Excuse me. To approve
For you to.
to approve a new notice of privacy practices policy to replace our current outdated HIPAA policy. I'll make a motion. Thank you. Greg.
I'll support.
Thank you. Moving supported. Any question? For Jeremy?
Yeah. Is this like 99% to comply with new HIPAA standards, or?
Yeah, our existing policy was getting fairly out of date, and we weren't even compatible with the last year's fifth. The agreements, such as what just happened with COA, were the ones that kind of brought the light, hey, we need to get this up to date and make sure that we're meeting our obligations.
And are we gonna have to redo this every year, or what's your thought on that?
My thought is every single time that a change comes out, we'll have to update it. It's in a lot better position right now. The way we've adjusted that, it will be smaller updates, but yeah, every time there's a big change, we'll have to incorporate.
Moving seconded. Yeah, I'm sorry, any other questions for Jeremy? Moving second, all those in favor, please say aye. Anyone opposed? Moving on, grounds use request, National Day of Prayer, motion to approve the Bel Air Ministerial Association and Friends of Veterans request for use of the front lawn space between the courthouse and the Antrim County Jail to host their National Day of Prayer event on Thursday, May 7, should be 2026, from 10 a.m. to 1 p.m.
I'll make that motion.
I'll support.
Thank you. Supported questions?
Didn't they do that? It was later in the day than that? It
I
was
was
like
gonna
12
say,
to
I think
1.
it was, I think it started at noon last year so that we could attend. I mean, if it's at 10, we're here at a meeting. You remember that, Jeremy?
Yeah,
I mean, it's, if they wanna get set up, maybe that's why they're doing it at 10 o'clock.
Could you email them and ask for clarification on that?
Otherwise, good, other than, I mean, is that, because our intent would be, we historically, Jeremy, have attended or at least taken a
Yes.
break at noon, so.
Yeah.
I think that's where. Okay.
Yeah.
All right. It was moved and seconded, all those in favor, please say aye.
Yeah.
Anyone? County Administrator's report, any questions for Jeremy?
Jeremy, did we get any information back from the soil borings?
not yet. We're expecting that next week.
Thank you.
Jeremy, the number 6, the Antrim Creek Schoolhouse.
Yeah.
It was brought up in our meeting and Lindsay wasn't 100% sure. The one document that was sent out said it was a $50,000 grant. And this one says it's about a $40,000 grant, so I'm just wondering. I didn't have an answer for,
Yeah, we asked for 50,000. They gave us 39,800 something.
because did you see the document of all the projects that got grant money?
Yeah.
And I don't know why, but Antrim Creek is like the very last one on the thing, and it says 50 or 49. So I was just curious if that's just showing what each group requested, or
That is the amount that we requested. It looked like they lowered it by almost $10,000 exactly. But we'll get additional clarification, but the documentation so far that they've returned has been the 39,000. But of
because
course,
I was just curious, the other organizations on the list, if they got less, did they really get the amount that's behind their name, or did they get substantially less than that? It's just,
yeah, I do.
it's a question.
Yeah, Jeremy, the lake levels, SAD, any with concerning Grand Traverse or Charlevoix County?
Nothing official, but it does sound like they're both wanting to take a step back. We were preparing that timeline that I told you about. We had something fairly graphical and simple to straightforward. Broke it down to 19 steps and demonstrated that we're on number 1. There's definitely pushback, and we'll have to consult with our attorneys on what that looks like, because to involve multiple counties means that they each have to follow those steps.
And last meeting on that same subject, you kind of went through for me all the steps that we have to follow, and I've been asked by a township what some of those steps are, and I didn't explain it real well, so.
The timeline will be available soon. We got it looking nice, but we had to abbreviate a lot because it's not a simplistic concept. So the attorney right now is reviewing it to make sure that we didn't abbreviate anything beyond what is appropriate.
Thank you.
And Jeremy, back to the schoolhouse, I'm certain that the Parks Department or ourselves, I mean, this is great news. Thanks to Lindsay for getting this grant for the schoolhouse. It's fantastic news. But we'll work closely with the ACNA board and Friends of ACNA. It will be a cooperative.
Yep, absolutely. They've I believe they already recommended taking some money and matching it so that we can get some of that foundation work and key pieces.
And thank you very much. Anything else for Genevieve? All elected officials left here today. I don't have anything to report, but Terry, anything last comment? No. Right? Any other comments? Chair, sorry.
It just, tomorrow is Good Friday and, Sunday is Easter, so. Just, been thoughtful of, Savior rising from the dead. So, thank you.
Any other public comments this morning?
Terry Moon again. This young gentleman here had some good ideas. I wasn't even thinking about that. Why are we crowding up our town with a big ass building, excuse my French, when we have no parking or anything for it, when we have all that other property outside the town? That was a pretty good idea, I thought. I think the board should look into that because I have a lot of friends that would like to open up businesses in this town, but there's no real estate to do that. My daughter's one of them. She like to enlarge her store. He's had that for 5 or 6 years now. There's no real estate to do that. So maybe the board might want to look into that out there because I've been at the kennel for 2 years. I haven't seen any activity at that ball diamond. So when does that get used? Does anyone know? Because I have not seen anyone on it since I've been at the shelter for 2 years and I've been there all hours of the day and during the summer months. So is that just something that's vacant now and was used at one time? There is a big area where he's talking. It's the same area that I tried to get him to mow that I had someone professionally put in a track for the dogs right next to the ball diamond. It cost me $500 to have someone level an area out for an oval track. So I would give all that up for a building because that makes more sense, but I would like to have that area taken care of so the dogs have an area to stretch their legs this year. It was taken care of the first year, it wasn't taken care of last year. Thank you.
Thanks, Terry.
Thank you, Terry, and I don't know if that ball diamond area is part of the deal, but there's plenty of land for a building to be put up there for 56 beds, whatever you think it needs, 100 beds, there's plenty of room there. And you got water and sewage, you got Meadowbrook process, you got a clinic there, but that's not what I was gonna discuss. These students or people that are going to school now, they don't get phonics and they don't get the cursive, and they're pretty much illiterate. And Jairus knows, he homeschools because he knows that that's the situation in the schools today. And I dealt with a graduate from Ellsworth at a store, and I put an Antrim review paper on the counter, and I dropped nickels and dimes, and the person just graduated from Ellsworth, and they didn't know what to do with that. I had to do the dimes and nickels to get it up to $1. So the people that are incarcerated today have been pretty much dumbed down. And if you go to deliveritdummydown.com, it's deliveritdummydown.com. You can find out why it is. If you go to bring in Mark Tucker's letter to Hillary Clinton in the 92, you'll see that's about 40 pages of what they plan on doing with these students. They have to be educated before they can adapt to being outside in the community. I have someone I know that's 26 that went through Bel Air, very smart, but he felt he was dumb because of what they're doing. They brought it here first. England brought it in the 90s. So education will be more than just rehabilitation. They have to know how to read, write, and communicate. I would think Jairus understands that. And then as far as these voting machines, I sent you all research done by Patrick Berg about the voting machines and the software that's in these voting machines that can be hacked. And I don't know if these are the same machines from 2020, but we went through one vote, 2 votes, and 3 votes. All of a sudden, we got what is necessary to get things done. And then there's also Lisa Peacock. She was in charge of 4 county health departments, and made our children wear masks. Police, our source for the people up in Lansing through the school year. My uncle came back from World War One, great uncle, and he had lung problems because the military sent from Kansas and Missouri, one of those states, over to Europe, and they got these respiratory issues, and they told them to wear masks. They all came back with bacterial pneumonia, and these children were forced, and no one on the board at that time did anything about it. They let Lisa Peacock, who had no authority, she never published it in the Federal Register, and Federal Register is a real thing, folks. Just look it up. There's agencies under there, they have to publish to get their authority. She had no authority to do that, but she did it to please the persons in Lansing, and all these students had to play sports with masks on, and there was no science behind it. And there's no law, and you know the register, I believe, Bill, because you're a jurist, and also the Administrative Procedure Act of 1943. That Federal Register was established in 1936, and we're still under that requirement for everyone to publish in there if they think they have the authority to mandate anything. And Lisa Peacock did it. She said, oh, I had to retire. She got over $200,000 compensation, I believe. She was so stressed out for making all, people were so upset with her for making these children that went through all summer without it. And then all of a sudden they need to wear masks, and athletes have to wear masks. And, someone was irresponsible there.
Thank you, John.
Get that out?
Thank you, John. Anyone else? Any more further comment, and we are adjourned. Thank you very much, everyone.